Okay, members, thank you. And I now declare the meeting open to the public online. And actually, just to reflect, this is the 100th meeting of the committee, members. So I'd like to welcome all the members who are participating by video conferencing, and also to remind members about the protocols regarding the use of electronic devices. So in terms of apologies, Pam Cameron has sent her apologies and has given her proxy vote to Deborah for today's meeting. Are members aware of any other apologies? No. Thank you, members. So members, then, what I would propose then, in light of that, we take the correspondence now in public session, and then we'll return to the Abortion Services Safe Access Zone Bill deliberations in closed session. So going first of all to correspondence, I draw members' attention to a number of items. Item 14.2 is a departmental response in relation to GP services. Do members have any comments in relation to that at this point? No, thank you, members. I think it's one we probably will return to in some shape or form, given the ongoing pressures in GP, but for now that's fine. Items 14.3 and 14.4 are departmental responses on the matter of neurology. And also included, before we go into that discussion, also included at tab 14.55 is a letter from the GMC providing further clarification on when they were first aware of concerns with Michael Watt. The letter advised that the GMC's employer liaison advisor was first made aware that local restrictions had been placed on Michael Watt in June 2017 before being formally referred by the Trust in April 2018. So I'd just like to check then if there are any other comments from members in relation to this element of our correspondence. Okay, are members content to note for the present pending further engagement with the department on the matter, and in particular when that INA report is published? Yeah, members content, thank you. Okay, members, item 14.37 is a response from the pay review bodies relating to equality screening in relation to the 3% recommendation. Any comments, members, in relation to that item? No. And so it is actually almost like they are saying that they believe that it's the department who's responsible. They're not responsible. So I think we need to send it back and ask the department maybe to comment, because the department had indicated us towards the pay review body. And now I think that we should go back to the department and ask for their comment on that correspondence if members are content. Yeah, thank you. Item 14.41 is a request from Disability Action to brief the committee on issues faced by disabled people during the pandemic. Any comments, members?
Chair?
Yes, Paula?
Thank you, Chair. No, I think we should. I met with some human rights campaigners last week, and the issue of disability rights came up. So I think that there are a lot of cross-cutting issues that we should be aware of and be seeking to address as a committee. So I think it's something we should try to schedule before the end of this mandate.
And we will be doing some work on our forward work programme here in this meeting as well. So that's an issue obviously that can be raised there. But that's fine, thank you. Moving on then, members, to item 14.46, which is a response from the NI Ambulance Service Trust containing a breakdown of the serious adverse incidents. Do members have any comments they wish to make in relation to that?
Chair?
Yes, Paula, go ahead.
Again, it's good that we got that response, and I welcome that they've now started a consultation into the wearing of the cameras on their vests, and I think we need to keep an eye on that broader issue of the welfare of the staff so that they can protect and serve the public. Thank you.
Okay, thank you.
Chair, just maybe just to get those AIs who are actually they're serious incidents or serious things that affect patients, isn't that correct?
Serious adverse incidents, yeah.
Yeah, so it's just, I say that there's 14, which is the majority, are actually located as workforce issue other. Would there maybe be any way of finding out what that actually means? Because I also see that delayed response is also one of the key issues as a team, and obviously that's down to, I'm sure, manpower issues and availability of resources, which I'm sure the ambulance service would appreciate us trying to champion on their behalf. But could we maybe get some more information about what caused the delayed responses and what the other workforce issues are, to see if there's a way that we as a committee could help?
Yeah, members content with that suggestion? We seek further information? Yeah. Okay, thank you, Colin. Orlia, I see your hand is raised there. I may have missed you.
Yes, Chair, sorry, it's just the note that I have from the correspondence was from last week's PEC, so I don't mean to mix you up with the numbers, but it was 1411 and 1417 from last week's PEC that's in this week's, but it was the response that we got on the crisis review. So the implementation plan has now been published by the Minister for the Regional Mental Health Crisis Service, and I just want to say that obviously this is a really, really important development and an important piece of work, obviously given the numbers of people that we still have that are presenting to emergency departments that are in crisis. So I just want to welcome that piece of work, and then hopefully the Minister, we can start to see some progress on that implementation plan being rolled out, because that's going to be crucial. And the second point was the letter that we got. It's the monthly updates that we're receiving around the CAM services and the waiting lists. So again, just to say, it's good that we're getting these regular updates, but the waiting lists are really, really concerning. I mean, some of those waiting lists have doubled for children and young people waiting on those assessments and those appointments. It did mention that they have filled a post with the new Managed Care Network Clinical Director, and I just want to welcome that, and hopefully that goes some way in reducing the waiting lists. But time will tell, and we'll see with the next monthly update that we receive, but it's just a note that.
Okay, thank you. And thank you, Orlia. And Orlia, if you could just lower your hand then, just in case I get confused as the meeting goes on. And I'll ask members, do members have any comments they wish to make in relation to any other pieces of correspondence? Okay, members. So are members therefore otherwise content with the actions as set out on the correspondence list? Yep. Thank you, members. Okay, members, thank you for that. That's correspondence dealt with, and we will now move to closed session to continue our deliberations on the bill.
Committee Room 30. This is the Northern Ireland Assembly Committee Room 30.